Hello, everyone, and welcome to United Way. Live United. I'm Terry Westerfield, and joining me today, I am so proud to have in friends from Project Lazarus. I want to welcome to the program Kim Moss, who is the Executive Director. Hello, Kim.
Hi, Terry. Thank you for having us.
Oh, I'm so glad you came. And Bruce came back. Thank you, Bruce. Bruce Galicero, who is Project Lazarus. He is the board chair. How are you doing, Bruce?
I'm doing fine, Terry. Thank you.
Oh, and Sam is joining us today. Sam Moore is a resident of Lazarus House. Hi, Sam.
Hello, how you doing?
I'm doing well, and you're sure looking pretty good, and I'm sure that's all because of Lazarus House, too, isn't it?
Yes, it is.
Well, for those of you who are joining us today, I want you to know that the mission of Project Lazarus is to help heal and empower people living with HIV/AIDS by focusing on their wellness, by providing housing, and offering important support services. Project Lazarus is one of United Way of Southeast Louisiana's partner agencies or community impact partners, and it provides transitional housing to people who are living with HIV/AIDS who have no other place to live. And why that sounds simple, it is extremely complex and far more than providing just a place to live. And Bruce or Kim, if you don't mind, I'd love to have one of you two kind of kick us off today.
Well, when you say that there's a lot more involved, you're absolutely right. People come to us because of a myriad of issues that they bring with them in their lives, and so many of them are just broken people. And we not only give them a place to live, but as you know, having a place to live that you don't have to worry about, that I can live here for, actually they can live for up to 2 years. And then offer them all these different comprehensive array of continuum of services from when they come in. We look at their issues and address those, and we have many programs that seek to meet their various needs.
Now, Kim, how many people can be living at one time at Lazarus? And you still call it Lazarus House, correct?
Well, Project Lazarus.
Project
Lazarus
Lazarus
House, of course, as well.
Yes.
People know it as that. We can serve 23 people at a time. In the course of a year, we serve about 65 people.
And I would suspect that there are so many more who would love to be able to be part of this project.
We hold a waiting list almost all the time. So yes, it doesn't take very long when somebody moves out that we have somebody waiting for that room and then moving in quickly.
I want to talk more about all the wonderful things you do with Project Lazarus, but Bruce, maybe you can discuss this too, because I know I'm looking on your website. We see the stories that come across well, I'm still old enough, I say wire service, but they're online or in the paper, or we hear them on radio or television, that it surprises people sometimes. But Baton Rouge and New Orleans, Louisiana, has a very high incidence of HIV and AIDS, and many people would think not.
No, absolutely. It's one of the highest in the country.
And is it, you think, because people just, they're not hearing it, they're not understanding, or are not getting the kind of education, or is it one of the things that's still a little bit taboo? People don't want to talk about it.
Well, I think the face of the disease has changed, and the epicenter of the disease has changed over the years, and I think what we're finding is that it's really come to the South. In the early years of the AIDS epidemic, the problems were more in on the West Coast and in New York. But as the years have gone by, it looks like a lot more of the cases are coming from the South.
And it's growing, and I know that, Kim, we've spoken about that before too, that sometimes statistics can not always project what is out there, but it's also a case of, we have a lot of folks who have not necessarily before reported or been tested. So, and that's what's always so important.
Well, that's right. Actually, for every 3 people who are tested, there's another person who knows they're HIV positive. There's another person out there who is HIV positive but is not aware of their status, and so therefore the potential for them infecting other people naturally is great because they're not aware of it and not able to seek treatment, and of course use the kind of prevention measures that are necessary to not spread the disease.
Well, there's an important point too there about I think being on medication makes a person much less likely to infect others. I mean, that's what they're finding. If you get on a good regimen and you take your drugs on a regular basis, it suppresses the viral level so low that they're actually unable to infect others.
And that is extremely important, because I think many of us unfortunately still remember when everybody was so fearful. Not that you shouldn't be aware, and that this is still something that needs to be fought with every weapon in our arsenal. But it's not the kind of thing where you can't touch somebody or hug somebody or, oh my heavens. I mean, we remember the Ryan White case and all these things, and just the treatment of so many people because they just didn't understand the disease.
Yes.
Well, AIDS was never a very easy disease to pass on, actually. But yeah, it's. But if you can get people on meds, it's just much better for them and better for society.
No, look at it in a sense. It's almost like there are so many people out there listening today who have autoimmune diseases, a variety. It doesn't matter what they have, but they too, as Bruce, you're pointing out, there are medications, and it will help suppress our system that way and they'll be better, they'll be stronger, they'll be healthier, and they can live better lives. And that's a lot about what Project Lazarus tries to do, to not only give you a place to live while you're transitioning, but all the other support services. And to me, that's just amazing. It's really giving someone a new lease on life.
It absolutely is. I mean, we see people come through whose lives are saved, and they'll be the very first ones to tell us or tell anyone that Project Lazarus saved my life. And I'm glad Bruce had brought up, and both of you, about the medication, because that is where Project Lazarus fits in. Because without controlling the disease, we can teach employment skills, we can work with all kinds of programs, but the number one issue is controlling the disease, and that is done through staying on the medication, being adherent to the regimen. And if you're out in the street or you're using alcohol and drugs, even if you're living in the community, you're much less likely to be taking your medication.
Now, the whole time that you've been talking, we have Sam over here who's been nodding his head. Sam, would you mind weighing in a little bit and telling us your story and how it fits in with what Kim and Bruce have been saying?
Sure. There's one point for me that, what they say about taking your medication.
Would you get just a little bit closer? I want to be sure people hear.
By taking my medication, I'm in an environment that I can able to do that every night now. Being on the street, I wasn't able to do it. Some of the side effects, like after you take your medicine, you're easy to fall asleep. You could be waking up by the police, wind up being locked up somewhere. So I found by me coming to Project Lazarus, I'm able to get myself together. I'm taking my medicine like I'm supposed to, and everything is working in the right order for me. And that's what I love about it.
Now you're there, so you're living there. How long have you been there?
Next month on the 22nd will be 7 months.
Wow. So it's up to 2 years, but you're learning all these other things too. So you're getting kind of a regimen, and you look like you're feeling pretty good, Sam.
I'm feeling very well about myself. It's like when I first come there, I wasn't able to read or spell that good. And thanks to Project Lazarus, I got a tutor that come there every week who teaching me to do the things I don't enrolled in school. So I'm doing all that, and my family coming back to me because I'm able to see my grandkids every weekend. That's one thing that I love doing. So I really appreciate the police.
So when you're saying lifesaver, you really mean it. You're getting to enjoy things perhaps you haven't enjoyed in a long time, and the fact that you're learning to read and write. And do you think this will help you then get a job? Is this part of what you're doing too with Project Lazarus and sharpening up those skills?
Yes, because of that, it wasn't the point of being a lack of skills. It was the point of being scared because I couldn't fill out the application like I wants to and all that. Now I'm picking up books that I wouldn't thought that I was able to do. And about to turn 51, that's a big head start in my life. I'm actually starting over. And I feel very good about myself now.
Better the second time around? I mean, it is. It's a whole opportunity. I just see such smiles on Bruce's face and Kim. Kim, how does both of you weigh at any time? Because it must make you feel really gratified to see Sam, and I see that big smile on Sam as well. What you're giving back to people and showing their lives, they are worth something. They are productive. They are cared about. They're loved.
I say often that I have the best job in the world. To see the changes in these people's lives, to come in and with their head down, and then after whatever period it takes to see the many changes, and they go out and they have jobs, they have their own apartments, they feel good about themselves, they no longer have negative feelings, they have a family now, and yeah, it's very gratifying.
And it's one thing I feel it's incumbent upon me to say this, and Bruce, too, as a board chair, maybe it's important as well, but sometimes people listen to shows, and they'll listen to what we're saying, and they'll say, well, you're a nonprofit, you're supposed to help people. But we often talk about how it's giving people the opportunity to be independent, to be self-sufficient, and also it's to give them an opportunity. This helps everyone. When someone like Sam, who's smiling and getting healthy and is learning to read and write and do these things again, it's helping the taxpayers. I mean, if you want to get really down to nitty-gritty kind of things sometimes, it's a great business proposition for people to be involved with Project Lazarus, with any of the social services, because we are doing this to make this a stronger community for individuals and for everybody.
Well, Lazarus, of course, has been around for almost 30 years now. In fact, next year we'll be celebrating our 30th anniversary. And I've been involved with Lazarus off and on for many years. And what's really encouraging is that Lazarus is just such a place of hope now. I mean, people used to go to Lazarus to die. And it's wonderful to be able to be involved with something that's so hopeful now. And I know as a board member, the real I guess the enjoyment I get is, like Kim was talking about, is seeing these people when they come to Lazarus and see the change and the transformation over time, and then hearing their stories. I mean, you can't get tired of hearing somebody say, Project Lazarus saved my life. You just can't get tired of that.
No, it's fabulous. And the things that you're doing to help save those lives, maybe you could talk about, because you've got so many programs that are going on within Project Lazarus and things to help people. I mean, you've got treatment programs, you have independent living programs, you have the wellness universe. We could go on, but maybe we should kind of take them one by one if we can.
Sure. About 70% of our residents come to us addicted to alcohol and or drugs, severely addicted. And so we have an outpatient substance abuse program with a licensed clinical social worker, certified substance abuse counselor who is on staff there, and we have intensive services wrapped around that. But when they first come in and we do an assessment and we see, what is it that these folks really need, and we try to make sure that we provide everything that they can need in-house, but if we don't offer it, we make sure they're connected in the community. But our Wellness University has turned out to be a very strong program where we have classes taught by licensed pharmacists, by educators from the community, where our residents go to eight-week classes to teach them skills on budgeting, on learning how to live with HIV, the importance of taking their medication. And then we have classes like yoga, acupuncture, massage therapy, meditation. So we just recently started a new spiritual component of making sure that we address all the needs, physical, emotional, and spiritual of our residents.
I was going to say, because when you talk wellness, then you tend to think of just the health in terms of medication or something, but this is the whole person. It's a holistic approach, literally, to getting well, to being better.
It is, and we're a program of the Archdiocese of New Orleans, and so it's always very important for us to remember, where we're from, but to be sure that we are providing all the opportunities individuals need. And as we all know, that our spirit, if our spirit is not right, I'm not going to be right. And we provide them with all kinds of opportunities. Our meditation gardens are absolutely amazing, with fountains and bird sanctuary and butterfly gardens. And we really encourage them and teach them how to go out and just be still and just think about being well.
Now, you're describing such a beautiful place, but to have that, it takes a lot of time, it takes a lot of effort, and it takes a lot of dollars, and a lot of that is also done by donors and volunteers. Isn't that correct, Bruce?
Correct, yes. We do receive a good amount of federal funding, excuse me, but we also have some events that raise money for Project Lazarus as well. We've got, in fact, coming up in the next few months, our next big event is called Bon Appetit. And it's where we have people have dinner parties basically all over the city, and then afterwards we all gather at one place for kind of an after party. But that event raised a good amount of money for us last year. And then we have other organizations that assist us. We've got an organization called Halloween New Orleans. which throws a series of events on Halloween weekend. And they've been doing that since 1987, and to this date, they've raised over $4.5 million for Project Lazarus over the years. So,
I want to tell you what, that Halloween party is something else, and I think I first became aware of it just about the time it began, and that is truly amazing. Everybody's invited if you can find a ticket, because they literally sell out.
Oh, it's a wonderful event. It really is.
And it's great because you know that this money is, again, you're being such good stewards of the donor dollar. What you say you're going to do with those dollars, you are. And the results are the people, the lives that you have given back. And again, Sam's just here beaming away. Sam, we were talking to you about how glad you are to be there, but tell us about if you don't mind, your average day and how things have gotten now that you're on your medication, you've been there and learning these other things. Would you mind taking us through a day with Sam?
All right, my average day, we're starting off when I get up in the morning. I don't go lay back down till that night because I keep myself busy. Like they say about the wellness class, I'm one of the few that take every class at all. I'm trying to take advantage of everything I can get. Like they say, it's never too late to learn, and I'm eager to do that. And I try to keep myself going. I got an old saying I always tell myself, only thing between a good day and a bad day is your attitude. So if I can keep that going, I know I have this beat.
Well, you're just making me feel better right now, and I think that's something we can all learn from each other, and that positive attitude. And again, that kind of goes back to, Bruce, what you were saying about that Project Lazarus gives hope.
Oh, absolutely, and you see it every day. I know last year we had someone here who spoke about her experience.
Yes.
And I remember her saying, and she's told the story many times, so I've heard it, but how when she came to Project Lazarus, she didn't trust anybody, and 'cause she'd been living on the streets for most of her adult life. And so she saw all these smiling faces and all these faces with hope, and she didn't trust them. And she said it took weeks before she was able to even trust those, the people at Project Lazarus. But in time, she's made an amazing transformation, and actually she's now working with Project Lazarus. We've hired her to.
Oh, wow. Now that's a great success story.
Isn't it, though? She went through and is such a strong individual and is clean, from drugs, and she moved out into the community, and I just couldn't help but notice what she had to offer, and peer support. So she's actually our peer support specialist, and she is on half-time right now, and she works with the residents when they first come in, doing orientation, getting them settled, making sure that people go to their doctor's appointments. She accompanies them quite often, and then is able to tell her story of having lived under a bridge and been a drug addict, and what Lazarus has done for her, and what each one of the people who come through to the agency, they can taste the same success that she had. So she's tremendous.
Now, Sam, is that something that's important to you, to have that peer support?
Yes.
And to be able to talk and tell your story with each other?
Believe it or not, she the one that told me about Project Lazarus. Because I've been knowing her for over 3 years now, and she been trying to get me to come over there for the longest. So when I finally had the chance to come over, she told nothing but the truth. It's everything she said is and more. So I can't express it anymore. The place been a wonderful life for me. It don't change me completely. And that's the way I want to live the rest of my time, that's doing what I'm doing now. It beats going to jail. Out there doing the things I was doing. And like I say, it's the only place I ever been in for this longer time. Going on 7 months, I never stayed in no place for 7 months. And so it got to be something good about it for the hell me sticking with it like that.
Sam, was that by choice that you never stayed any place very long, or is it just because of other problems that you had?
Because of the problems and my alcohol and drug use. Like I said, it's the first time that I'm actually going on 7 months and I'm clean today. And it feels very good.
Did it start when you were very young?
Well, I started drinking at the age of 9.
Ooh. Was it to escape, or?
No, that's coming from a family that was a party family. That was just something that was in the house at all time. And I happened to pick it up, and I've been doing it ever since. But like I say now, going on 7 months, I really feel good about myself. I honestly could say that I'm clean today.
And sobriety is a very good thing then.
Oh, yes. I make sure I go to my meetings and everything. I keep everything going like I'm supposed to. Because I figure if I stop and get that big head again, I'm going to wind up going back out there and falling down. That's something I don't want to do no more.
And you were telling us earlier about how excited you are when your grandkids come to visit. Was that something that did you get to see your grandkids much before you joined Project Lazarus?
No, not being on the street, because I didn't want them to see me in that stage of mine, because I wasn't together. But since I've been at Project Lazarus, the place I can actually say saved my life right now. It's fun for me to be around them now. And they're happy to see me that I'm sober and clean.
You sound very proud, and you have a right to be.
Yes, I am. I'm very proud of myself.
And you've got to be proud of, I'm proud right now of the guys sitting here across from me, of Bruce and Kim, because all they've been able to do to help you, Sam, and other good folks who needed that hand up. And again, we were talking about some of the programs and the wellness, but you have, Kim, it's just, you're scratching the surface. There's so many other things you do too.
Well, one thing that's very important is people are living longer and going out into the community. Their health is better and they want to go back to work. So we take the opportunity while they're there with us. We've established a new program called Laz Works, where and hiring Tasha was a part of that. Hiring a resident attendant who actually goes through the interview process and then helps in the gardens and helps with housekeeping. We're about to launch an internet cafe called Laz Cafe there on campus that'll be for the residents, and we will be we have a espresso machine teaching them barista skills, how to make the specialty coffee drinks, how to wait on tables, how to run a cash register, how to close out the cash register, and we'll have our own little internet cafe. People can, from the agency, the staff, and the residents, you can come up and just hang out and learn those skills, and we're very excited about that.
So that means one day when Sam's ready, Sam, you may be serving me some coffee in the morning when I'm trying to make up my mind, and you're going to say hazelnut with what?
Yes.
But it is so wonderful that you do all these things. I'm thinking along about what you had said earlier too, Kim, that sometimes people may not remember that this was developed by the Archdiocese of New Orleans, and it was a very big first step for them to take.
It was a huge first step for them to take, and from what I've heard is that it was controversial, at the beginning, because it did strike the young gay community of New Orleans. But the Archbishop at the time just said, we've got to help these people. And the agency, as Bruce talked about earlier, lost so many people. It was a place where people came to die. And now we have people who come there, and they come there to live. And we're very proud for what the Archdiocese continues to stand behind us very strongly.
Now, how does someone like Sam, now Sam found out about it from Tasha, right? But about others, if hopefully if someone is listening today, that they're taking this message home and maybe they know someone or know of someone who knows of someone kind of thing. And we need people to find out about Project Lazarus. We need people to support Project Lazarus. So do they go on a website? Do they come and knock on the door? How does one get started in the process?
Well, they can do any of that, a phone call, but we have to have a TB test to make sure that, they do not have tuberculosis. So there has to be some medical component, and typically it comes to their case manager from No Age Task Force or from the HOP clinic. But, we have people also who just, a friend, frankly, who will call and say, I have a friend who needs to come in. What do I need to do? So all they got to do is call us there to the agency, 949-3609, and just ask, how do I get in? And they'll be sent to the proper person.
Now I'm going to ask you to stop and let's say do it one more time, because right now someone's running to grab a piece of paper and a pen or pencil.
It's 949-3609. And we have an excellent website at projectlazarus.net, where if anybody wants to really learn about us and see pictures of the campus and more about our programs at their leisure, certainly invite people to go to our website.
And you do have some wonderful things there. We just briefly hit upon earlier about volunteers. And I would imagine that volunteers are needed quite a bit. Bruce, Kim, or at least for maybe some of your special events?
Yes, so we work with a number of volunteer committees on there. We have a development committee. We have committees for each one of our events that we're involved in, and then I know volunteers also help around at Project Lazarus as well, the grounds. And gardening, that sort of thing.
Well, and our Wellness University has been a great opportunity, too. We actually have a gentleman who is a retired principal who comes and he teaches one of our wellness classes.
Oh, that's great.
People can come and just play cards with the residents, board games, just sit out and talk. No, you don't have to have a specific talent or ability other than just being friendly and just genuine and want to spend some time with people.
I would say it almost sounds like everybody's benefiting this, not only those like Sam who are residents right now, but those who've got some time on their hands and want to reconnect with the community and give something back. So it's a great opportunity. It's kind of a win-win situation.
It certainly is.
Well, I know that you were talking about so many of the things that go on, and you try to be that holistic approach of having everything there, but sometimes you do have to reach out to other nonprofits. You mentioned No AIDS will sometimes funnel people through, and the HOP Clinic, others. Are there other groups, other nonprofits with whom you also work?
Oh, there's many. We use a number of the workforce organizations in town. We work closely with Belle Reve, which is another transitional facility, and we actually have residents of Belle Reve and residents of Trinity House who come and take advantage of our substance abuse program. So they leave their campus and come over and go through some components of our programs.
And that's nice because that way you can work together, and I'm sure if it's not repetitive, that way you can fill the slots and what's needed and help each other in that manner.
Right, yes.
Well, I tell you what, we have just a few minutes left, and I'm hoping I could go around the table and ask each of you one thing that you would love people to take home today from this interview. And Sam, if you don't mind, I want to start with you. What do you want people to know about Project Lazarus and why it's so important?
Well, one thing they should know, it's the place to be if you really need somewhere to go. If you're trying to start over and get your life together, I recommend it highly. That's basically what I can say.
I was going to say, you said it saved you.
Oh, yes, it did.
And Kim, when you hear something like this?
Well, of course, it's wonderful to hear that. And I'd have to say that the one thing that I can say in ending is that if you have not come for a tour of the campus of Project Lazarus, you don't know Project Lazarus. And we invite people to come for tours, and I love it. I love stopping what I'm doing and just showing people our magnificent campus that it encompasses almost an entire city block.
And that's amazing, especially the location is wonderful. And again, with all that you're giving forth in terms of educational opportunities, I love the idea of the Laz Cafe. Sounds like something that maybe you'll even branch out. It could be a little revenue source there. Some of us will stop by and get our coffee in the morning.
Who knows? Yes.
And Bruce, as a board chair, I know you have a lot of responsibilities and looking to the welfare of not only the organization of Project Lazarus, but also all those who are employed and live there.
No, it's a wonderful program. It really is. I'm thrilled to be involved in it. We have lots of wonderful nonprofits in New Orleans, but I think Project Lazarus is one of the best I've ever worked with. I just think that we're as people, we're always at our best when we're helping other people, and with a place like Project Lazarus, it's so easy to see. Your help in action.
And I think that's what's so great about it, the fact that it's there, and it's really something that others could emulate. I mean, in terms of a nonprofit and what you're doing and how you're returning those to the community, it's almost overwhelming in the depth that you have gone and what you're doing for someone. And I would imagine, I do kind of want to end a little bit the program on this too, because you talked about how it's the changing face of those who are HIV/AIDS positive. And I imagined if anybody who was listening today did take you up on your option to come on over and visit Kim, we would be amazed at the different people we see.
That's true. We have about 45% are female, so we have a lot of women who live there. We have transgender individuals. black, white, Hispanic. We just open our arms and accept everyone where they are, and so much of the issue now, particularly down in the South, is among African Americans as well. And so we have people who unfortunately are 18 years old who get infected and come to us, and all the way to, we recently had a guy who was in his 60s and had just unfortunately recently been infected.
Well, I'll tell you what, again, fabulous, fabulous Project Lazarus. I want to thank so much Bruce Galicero, who is the Project Lazarus board chair. I want to thank Kim Moss, who is the executive director of Project Lazarus, and Sam Moore, who is a current resident there at Project Lazarus. And the mission, folks, of Project Lazarus, one more time, is to help heal and empower people living with HIV/AIDS by focusing on wellness, providing housing, and offering important support services. Project Lazarus is one of United Way of Southeast Louisiana's partner agencies. I'm Terry Westerfield, and for United Way, let's live united.